Mesothelioma. Mesothelioma is primarily caused by exposure to asbestos fibers. It commonly affects the lining of the lungs, but can also occur in the lining of the abdomen peritoneal mesothelioma or the heart pericardial mesothelioma. Symptoms may include chest pain, shortness of breath, and abdominal swelling. Pancreatic neuroendocrine tumors. These tumors arise from the hormone-producing cells of the pancreas. Unlike more common pancreatic cancers, neuroendocrine tumors tend to grow slower and have a better prognosis. Treatment options may include surgery, chemotherapy, or targeted therapy. Adrenocortical Carcinoma. Adrenocortical carcinoma is a rare cancer of the adrenal glands. It can produce excess hormones such as cortisol, aldosterone, or androgens, leading to symptoms like weight gain, high blood pressure, and masculinization in women. Treatment typically involves surgery, sometimes followed by chemotherapy or radiation therapy. Cholangiocarcinoma, also known as bile duct cancer, cholangiocarcinoma can occur in the bile ducts within or outside the liver. Risk factors include conditions such as primary sclerosing cholangitis, an inflammatory disease of the bile ducts, and infections with certain liver flukes. Treatment may involve surgery, chemotherapy, or liver transplantation. Gestational trophoblastic tumors. These tumors arise from abnormal placental tissue after conception. They include hydatidiform moles, gestational choriocarcinoma, and placental site trophoblastic tumors. Treatment often involves surgical removal of the abnormal tissue, followed by chemotherapy in some cases. Gastrointestinal stromal tumors. GISTs are rare tumors that develop in the gastrointestinal tract, most commonly in the stomach or small intestine. They are often caused by mutations in the KIT or PDGFRA genes. Treatment may involve surgery, targeted therapy such as imatinib, or other medications. Uveal melanoma. Uveal melanoma is a rare cancer that affects the uvea, the middle layer of the eye. It arises from melanocytes, the cells that produce melanin. Symptoms may include blurred vision, floaters, or changes in the shape of the pupil. Treatment options may include surgery, radiation therapy, or targeted therapy. Thyroid cancer. Thyroid cancer originates in the thyroid gland, which regulates metabolism. It can be classified into different types, including papillary, follicular, medullary, and anaplastic thyroid cancer. Treatment depends on the type and stage of cancer, but may involve surgery, radioactive iodine therapy, or targeted therapy. Ovarian germ cell tumors. These tumors develop from germ cells within the ovary, which are responsible for egg production. They are most commonly found in teenagers and young women, and often have a good prognosis, especially when diagnosed early. Treatment typically involves surgery and sometimes chemotherapy. Acute lymphoblastic leukemia. ALL is a type of cancer that affects the white blood cells, particularly lymphocytes. It is the most common type of leukemia in children, but can also occur in adults. Symptoms may include fatigue, easy bruising or bleeding, and frequent infections. Treatment usually involves chemotherapy, sometimes combined with targeted therapy or stem cell transplantation. Myelodysplastic syndromes, MDS, are a group of blood disorders characterized by abnormal production of blood cells in the bone marrow. This can lead to low blood cell counts and an increased risk of developing acute myeloid leukemia. Treatment may involve supportive care, medication, or stem cell transplantation. Retinoblastoma. Retinoblastoma is a rare cancer of the eye that typically occurs in young children. It arises from immature cells of the retina, the light-sensitive tissue at the back of the eye. Symptoms may include a white pupil, eye pain, or vision problems. Treatment options include surgery, chemotherapy, and radiation therapy. Carcinoid tumors. Carcinoid tumors are slow-growing neuroendocrine tumors that can arise in various parts of the body, including the gastrointestinal tract, lungs, and other organs. They often produce hormones such as serotonin, leading to symptoms like flushing, diarrhea, or wheezing. Treatment depends on the location and extent of the tumor, but may involve surgery, medication, or other therapies. Esthesioneuroblastoma. Esthesioneuroblastoma, also known as olfactory neuroblastoma, is a rare cancer that arises from the olfactory nerve in the upper part of the nasal cavity. Symptoms may include nasal obstruction, nosebleeds, and changes in sense of smell. Treatment typically involves surgery, radiation therapy, and sometimes chemotherapy. Peritoneal mesothelioma. Peritoneal mesothelioma is a rare cancer that affects the lining of the abdomen. Like other types of mesothelioma, it is often caused by exposure to asbestos. Symptoms may include abdominal pain, swelling, and weight loss. Treatment may involve surgery, chemotherapy, and sometimes heated intraperitoneal chemotherapy. Thymoma and Thymic carcinoma. Thymoma and Thymic carcinoma are rare cancers that arise from the thymus gland, which is located in the upper chest. Thymomas are typically slow-growing tumors, while Thymic carcinomas are more aggressive. Symptoms may include chest pain, cough, and difficulty breathing. Treatment may involve surgery, radiation therapy, and chemotherapy. Merkel cell carcinoma. Merkel cell carcinoma is a rare and aggressive skin cancer that usually appears as a painless lump on the skin. It arises from Merkel cells, which are found in the top layer of the skin. Risk factors include sun exposure and a weakened immune system. Treatment may involve surgery, radiation therapy, and sometimes chemotherapy or immunotherapy. Basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer, but in rare cases, it can become more aggressive and invade surrounding tissues. It typically appears as a shiny pink or red bump on the skin, often on areas exposed to the sun. Treatment usually involves surgical removal of the tumor, although other options such as cryotherapy or topical medications may be used for smaller lesions. Giant cell tumor of bone. Giant cell tumor of bone is a rare tumor that usually occurs in the bones of young adults. It is characterized by the presence of multinucleated giant cells. Symptoms may include pain, swelling, and limited mobility in the affected bone. Treatment may involve surgery, radiation therapy, or medications such as bisphosphonates or denosumab. Fibrolamellar hepatocellular carcinoma. Fibrolamellar hepatocellular carcinoma is a rare subtype of liver cancer that typically affects young adults without underlying liver disease. It is characterized by distinct histological features and tends to have a better prognosis than conventional hepatocellular carcinoma. Treatment may involve surgery, liver transplantation, or other therapies depending on the stage of the disease. Gallbladder cancer. Gallbladder cancer is a rare but aggressive cancer that starts in the cells of the gallbladder, a small organ located under the liver. It is often diagnosed at an advanced stage, as it may not cause symptoms in the early stages. Symptoms may include abdominal pain, jaundice, and weight loss. Treatment options may include surgery, chemotherapy, and radiation therapy. Vulvar cancer. Vulvar cancer is a rare cancer that affects the external genital area of women. It typically occurs in older women and is often associated with chronic inflammation or infection, such as human papillomavirus infection. Symptoms may include itching, pain, and abnormal bleeding. Treatment may involve surgery, radiation therapy, and chemotherapy. Paget's disease of the breast. Paget's disease of the breast is a rare form of breast cancer that affects the skin and nipple of the breast. It usually occurs in conjunction with ductal carcinoma in situ or invasive breast cancer. Symptoms may include redness, scaling, and itching of the nipple and surrounding area. Treatment typically involves surgery, often followed by radiation therapy or chemotherapy. Ampullary cancer. Ampullary cancer, also known as ampullary carcinoma, is a rare cancer that originates in the ampulla of Vata, where the bile duct and pancreatic duct meet and empty into the small intestine. It can cause symptoms such as jaundice, abdominal pain, and weight loss. Treatment typically involves surgery to remove the tumor, followed by chemotherapy or radiation therapy if necessary. Mucosal melanoma. Mucosal melanoma is a rare and aggressive form of melanoma that develops in mucosal tissues, such as those lining the respiratory tract, gastrointestinal tract, or genitourinary tract. It is often diagnosed at a later stage than cutaneous melanoma and has a poorer prognosis. Treatment may involve surgery, radiation therapy, chemotherapy, or immunotherapy. Alveolar soft part sarcoma. Alveolar soft part sarcoma is a rare type of soft tissue sarcoma that typically affects young adults. It most commonly occurs in the muscles of the thigh or buttock. ASPS tends to grow slowly, but can metastasize to other parts of the body, particularly the lungs and brain. Treatment may involve surgery, radiation therapy, or chemotherapy. Extravaganal germ cell tumors. Extragonadal germ cell tumors are rare tumors that develop from germ cells outside of the gonad's ovaries or testes. They can occur in various locations, including the mediastinum, retroperitoneum, or pineal gland. Treatment depends on the location and extent of the tumor, but may involve surgery, chemotherapy, or radiation therapy. Angiosarcoma. Angiosarcoma is a rare cancer that develops from the cells that line blood vessels or lymphatic vessels. It can occur in any part of the body, but most commonly affects the skin, breast, liver, or soft tissues. Angiosarcoma can be aggressive and difficult to treat. Treatment may involve surgery, radiation therapy, chemotherapy, or targeted therapy. Leiomyosarcoma. Leiomyosarcoma is a rare type of cancer that arises from smooth muscle cells, which are found in various organs and tissues throughout the body. It can occur in the uterus, gastrointestinal tract, or soft tissues. Treatment depends on the location and extent of the tumor, but may involve surgery, radiation therapy, or chemotherapy. Osteosarcoma. Osteosarcoma is a rare cancer that develops in the bone, usually in the long bones of the arms or legs. It most commonly affects children and young adults. Osteosarcoma tends to be aggressive and can spread to other parts of the body. Treatment typically involves surgery to remove the tumor, followed by chemotherapy. In some cases, radiation therapy may also be used. By increasing awareness, supporting research efforts, and advocating for access to specialized care, we can make strides in combating these diseases and improving outcomes for those affected. Don't forget to like, subscribe, and share your thoughts in the comments below. Until next time.